to get the best quality care for your patients is skills that you really need to pick up once you're actually working as a resident. So the way I try to approach it is every single day, I just try to add one new thing to my arsenal that I can then use to be a better doctor. And it could be as simple as this when you're just starting out in residency. The first day I had a patient, they needed a blood transfusion because they had a hemoglobin of less than 7 and were symptomatic, but I didn't know how to properly place orders to get a blood transfusion. And so I learned how to do that. Also making sure that the patient's properly signing the consent form and they're informed of the risks and benefits of getting blood. Just simple things like that you're just not going to do as a medical student. I'm starting to learn as a resident physician. I'm now going to be comfortable. Every time I've had to do it after that, I knew exactly what I needed to do. So what I would say is that in your first month, just try to start to pick these little things up, and also don't put too much pressure on yourself. Roll with the punches. If, for example, in my first 3 days, I had 3 different attendings, and every single attending wanted to see things done in different manners. Some people like notes being done earlier. Others don't want notes done until later in the afternoon. Some attendings want you to present one way, and others will have you present in a different style. And so you need to be very adaptable as a resident. You also shouldn't let anything come at you personally, because if you do, it's going to be a long 3 to 7 years of residency, however long you're in residency for.